KUAM News Hotspot is presented by Calvo Enterprises, Inc.
Howdy everyone, and welcome to The Hub. I'm Nasser Licanto, and our guests this week are Corina Balesta and Anthony Tyron of HMI. And I'm going to ask you, Corina, to start us all off and explain what is HMI, what does it stand for, and what does your organization do?
Oh, thank you for having us. So HMI stands for Intramural Ihanano Imagahe Zeni Inina, and it means the way, the truth, and the light. And it was started by Anthony Tyron, Bill Salisbury, Matt Choffris, and Brian Hahn a few years ago, and I'm new to the team. I've only been with them for a year, but everyone said that it seems like I've been with them for a while, but I think it's because I love what the mission is. So they started out assisting veterans, and I guess Anthony can jump in if I missed anything, but they assist veterans with the VA claims process. So the VA claims process is very intimidating. So veterans have a hard time navigating it. So we're here to help them with that process.
Okay, and you've got a couple events coming up, but we'll talk about that later on in the show. Anthony, I also wanted to give you an opportunity to expand further on what the organization does as a founder. What made you want to start this?
So what had happened was we had three of us that were veterans, and then we had a friend that wanted to help us do this. So Matt Choffris, Bill Salisbury, myself, and Brian Hahn. Brian is the only one who was not a veteran that actually joined us, and his job was to help us put this together. So when we did that, our thoughts were, how do we help veterans, and what could we do, and what's something that veterans needed that would help them out here. And initially we started out doing village outreaches. Now that's from the HMI standpoint. So even before that, as my shirt would have, it's the by veterans for veterans. So when we first started out, we put together a chat group, a WhatsApp chat group, and we said, hey, if anybody's interested in doing these things, jump onto this chat group, and what we'll do is we'll help you understand what we know, our experiences from navigating the process. And we also had a doctor that was with us that was able to help us. It's Dr. Akoma in his clinic. So initially, that's what we started. And we started out having veterans jump on the chat group. We started educating them about the things that we learned, what was successful, what wasn't. When we talk about VA claims, it's a disability that we're applying for. And when you're applying for a disability, the person that's able to tell you have a disability is a doctor. So we can have other folks come in there and do things like, hey, this is what you're applying for in the VA. However, it's the doctor that actually determines that. So that was initially our start, was by veterans for veterans on the chat group. We started out at Doc's clinic. He'd open up his clinic, and we'd come there, bring veterans, start educating them. And then we went out into the villages, and we did some of that once HMI was actually established.
Yeah. As everyone knows, Guam has probably the highest percentage per capita of military enlistment. We take pride in that. But along with that comes some issues with the veterans when they get out of the service, right? And Corina, you've been involved in assisting them. Tell us what you think are some of the biggest challenges that they face.
Well, currently, we fall under Hawaii's for VA healthcare. And believe it or not, we only have a really, I like to say, small clinic. The building outside of Naval Hospital, it's the community-based outpatient clinic, stands for CBOC. Most veterans, we just call it CBOC, or the VA clinic. I was able to visit the VA hospital in Vegas, and it is huge. It's beautiful. It's so big you get lost in there. But the services there is nothing compared to what we have here. Here, if there's no enough doctors for the veterans here, we get sent out to care in the community, which is civilian doctors who don't really know the VA process. So my care, I'm assigned to a VA doctor, but a veteran B could be assigned to a civilian doctor. Well, I can't tell that veteran how I'm being treated or what they should be doing, because the civilian doctor should know. But I feel like the civilian doctors don't know the process or how to navigate the VA world, as I'm taking care of as a VA patient and with a VA doctor.
Yeah, Anthony.
I think that's one of them.
Sure. Anthony, you want to add to that?
So when it comes to what goes on with veterans and what's going on out here, there's a lot of education that a lot of our folks out here need, and I think we're far away from the source. When I talk about that, right, it's the Department of Veterans Affairs is outside of Guam, right? They're in Hawaii. We fall under Hawaii, and if you go even further, right, east, right, you'll be in the United States. And a few things that we've been finding while we're here on the ground talking to our veterans and seeing things that are going on. The process is difficult. If you go to the United States and you Google veterans, like nonprofits and folks that donate to these nonprofits, in the United States, they have all the amenities, they have all the facilities, they have everything out there. They don't need anything. If you look at their nonprofit lists, you could scroll up and down on your phone. It's endless. They already have resources. They already have everything from the Department of Veterans Affairs, and yet they have folks outside giving them even more. Now, how do we capture that? I mean, here on Guam, we continue to talk about needing so many other things. We have great organizations that exist out here that are doing so much. And one guy, one of the people from Ambrose, who are one of the folks that are helping us, told us it shouldn't be the veterans putting their money together to help themselves. It should be larger corporations and the folks that, you know, have the funding and the government and grants to come help us with these things. So it's a tough battle. We have to continue to be very gracious when the VA and our front office, you know, our governor and lieutenant governor, when they say, hey, we're giving you this, or we're trying to help with this, we have to accept that. And veterans sometimes have a hard time, right? It's tough for them when they're seeing some things come in and it's probably not to their liking, or they expected a little bit more. So that's some of that challenge as well.
Yeah, and I'm aware that the head of the Veterans Affairs Department has been to Guam, a couple of them in recent years. Have you had a chance to meet or speak with them?
So we're a very new group. So out here we have folks like the Vietnam Veterans Association and the Purple Heart, right? These folks have been around for a while. It's Nick Francisco that's leading those guys. And I think Rick Cruz is the regional Purple Heart representative. We also have the Legion and VFW. Stateside, these organizations do a great deal for the folks out there. So if we join groups like that out here, one of the challenges is we put into a system, and the money that we generate here goes back to them. And it's kind of funny that we're raising funds and the money leaves here and we need some of the services. But I think we're starting to bring people together, these organizations and groups, to help us help ourselves, if you will. So with that in mind, there's still quite a bit of things like Assistant Secretary, I think is his title. I hope I didn't butcher that. Remy came out here, and he was out here, and when he was out here, he talked about it being a listening tour, and they're trying to understand what's going on out here. What we're looking for and what they do stateside or on the federal level is very, very difficult to process. We say we need this and we expect it now. They have to go back and talk to Congress, gather all the data, put it together, run it through a bill, say, hey, you know, these folks down here have been having this trouble. I mean, just recently we had the PACT Act that deals with folks from Vietnam, and that's the Vietnam era that they're trying to address hypertension. And when you talk about something like that, it took 50 some years before the federal government came in and said, hey, we have to address that issue. So things like that. And when you look at the process that we go through, as difficult as it is, right, there may have been bad actors in the past that would have forced the VA to do what they're doing and provide the guidelines, and we have to meet those guidelines in order for us to be able to avail of the services and benefits. So the VA doesn't not want to help us. It's a challenge for us to give them what they want because the way the system is built and works.
And you guys are there to help cut through the red tape. We got to take a quick break, and we'll be back with more with Karina and Anthony right after this. And we're back with Karina Balesta and Anthony Tyron of HMI. Before the break, we talked a little bit about, one of the biggest challenges for veterans is the medical. But combat veterans in particular also have, in addition to medical issues, they also have maybe emotional issues. And I was wondering if you can share some of your experience helping with those gentlemen and women.
Okay, so they experience mental health issues. We call it PTSD or anxiety, depression. There's a whole list of issues that fall under the mental health umbrella. So I think the issue we have here in Guam is getting care. Are there only maybe two providers that we could see that we get referred to? Yes. So face to face. A lot of veterans do not like the tele appointments. They don't want to be online talking to a phone. They want to sit with someone in person, but because there's so many of us, there's only 2 providers here, and so we're all fighting for appointments. I think our appointments are anywhere from 3 to 6 months out from the last time you saw the provider.
Yeah, that makes it difficult for them having, to wait so long when their need is probably more immediate. Yeah.
Yes, and so when we talk about the mental health side of the house, right, or behavioral health, if you want to be correct, I guess there's different terms. However, for a lot of our combat veterans, that is quite huge. Here on Guam, I think we have the Governor's Challenge, I think, is one of the new things that was being put together, which brought together a lot of other organizations like behavioral health, West Care, the Guam Police Department, I think, is in that Governor's Challenge, and some other organizations that help veterans and help people in general. So one of the things they were doing at that challenge was trying to identify how to address a veteran, for example, when there's a call to a residence and the police have to go there. And of course, that's already a challenge. And for the veteran, if they're there and a police officer comes there and they feel that, hey, this is a challenge, that these people are coming for me, this is my house, I got to protect my place. And in all actuality, the police officer is not coming there because he wants to come there and cause trouble, or he's coming there because they're calling him to this place because there's some argument, there's loud noise. So now we have to identify, as police officers, they have to go through training. So I think those are some of the things that they're starting to do, so that when they come to these places, they want to identify, is this person a veteran? And a lot of that falls on the folks taking the call in, the 911 folks. They're gathering as much information. But I think because there's a large population of combat veterans here on Guam, that should be something we should be looking at. And I think they are. And this Governor's Challenge is something that, is helping that as well. So with that in mind, that whole idea is something that we need to continue. And I sat in on that Governor's Challenge initially, and I found that's a really next level putting together things, really smart people from stateside and here that are organizing how to make that happen so that it's seamless and we continue to capture the veteran and the families all along the way. And that's a tough thing because it's not easy, right? And you never know, right? You could have a veteran who has some challenges that might be sitting right in front of you talking to you and everything's fine, and then maybe out of the blue something happens that causes him or her to not feel comfortable, and then that's when things would change. Now, most normal people won't get that. Most veterans understand that, oh, maybe there's a challenge going, let's see what we can do, right? When we see these veterans in the clinic and we're trying to take care of them, right, they're talking to us like we're the ones that caused their problem, and like we're the VA, and we tell them, we're not the VA, we're going to try to help you and help you understand it. And there's things that when this happens, it's really tough for them. But veterans kind of get it. They understand. If you talk to a veteran and a veteran's talking to you, they're kind of comfortable. They're like, oh, that's fine, right? That's just Karina, that's just Anthony, or that's Jesse, right? So we know each other, and we can maybe ask the question, hey man, is everything okay, right? And then for them to ask that question, it's fine. You put a guy in a badge who's in there intimidating, big muscles coming in like he's trying to take charge of a situation, you probably get a veteran looking at, what is this guy doing here? So it's a totally different
Sure.
approach.
Yeah, and Karina, one of the things that I've heard over the years is that a lot of veterans, particularly maybe those with PTSD, there is a reluctance to come forward and avail of services. Have you found that?
Oh yes. So when we sit with veterans and they like one-on-one for a reason, it's because they don't want everyone to hear their business. So when we sit with them one-on-one, I tell the males most especially to be vulnerable, because we're not there with you every day. We're not there with you when you can't get out of bed for 2 days. We're not there with you when you argued with your spouse for some reason. We're not there with you when something triggered you. So when you're talking to your provider or when you're talking to another veteran, you just feel safe because you trust another veteran, because we're all brothers and sisters in arms. So I think when it comes to PTSD, they have to be vulnerable, especially most with when they're at their appointments or when they're talking to us when we're helping them, because some of them won't want to say, well, I have PTSD. It's another veteran that's been through the process that says, yes, you do, because we just want to, and culturally we just want to not say that we do.
Yeah, and being vulnerable, that might be difficult for them because it's counterintuitive to their training, right?
Yes, it is.
And I was just thinking of something too. So there are things that are in place for a lot of our veterans, and so this is also the reason why we push them to register at the CBOC, right? We push them to apply for their benefits, because when a veteran gets his or her benefits, right, they now have medical care, they have money in their pocket, and now they have an ability to improve their lives. And let's say you get 10%, right? That's money in your pocket, so there's a little less stress on you. It's $160 some a month, and you get to access base. You get to go gas your car, go to commissary, and then you have the CBOC or the VA healthcare side able to provide these things to you. So these are reasons why we do that. There was also something from the Secretary of VA that said, if there is a veteran who is going through a crisis, the VA will pay for the ambulance to go to this veteran and take him, paid for by the VA, and then take him to a facility, for example, behavioral health or a private facility, and the VA will pay for that. If they have to be there for longer than the initial visit, they pay for that as well. So capturing that is important also. So if we can look at those things, get veterans to come out, and that's part of what we're doing is we invite them to, hey, this is a good time for veterans. It's not, we're not pushing them away. We're not trying to make them feel like, hey, you got a problem. And if you do, that's fine. You got a problem with all of us because we all are the same. And what benefits and incentives are there for us to keep doing this so that we all have a long life, and the economy is benefiting from this, because the more we get our veterans to get their funding and their money, the money comes here, and for the rest of their life they get that money. When they get their health care, VA pays for the people up at the CBOC to have jobs. When we go to care in the community outside, VA pays for that. So we got to find all these undocumented veterans, right? And we got to find them, and we got to register them, capture them, put them in there, get them in the system, get them to get their benefits. There are so many folks that have come to us. We just help them put their paperwork together. And since they got out of the service, we did absolutely nothing other than put their paperwork together with them, had them sign it, and sent it off. And they immediately got 100%. Yeah. Some of these people are missing $500,000 because 10 years ago, the same thing we did for them this year, they should have done that. And every year they would have got $50,000. But we're missing out on that because nobody's telling these people that they should go do this. And the money comes back to us. Yeah. It comes back to the economy. And now it won't be a depressed economy anymore. We'll have a lot of folks to help the veterans out in the community for their care. All the folks will be working on the base. That money comes from the veterans. That money goes out and gets out in the community. So I think it's a win-win-win all the way across the board for veterans.
Yeah, and that undocumented veteran has been an issue for a long time. They have failed to come forward, and they had all this opportunity and all these benefits if they had only come forward. We got to take one more break. We'll be back to talk about a couple of events that they have planned coming up. We'll be right back. And we're back with Karina Balesta and Anthony Tyron of the HMI organization. You have a couple of events coming up. Karina, tell us about the first one.
Yes, we do. So the first one is on November 10th. It's our first, I'm going to call it annual. Can you say first and annual? It's in the same sentence?
Sure.
So our first annual
Just
veteran.
make sure there's a next year, too.
Okay. A veteran gala. It's going to be at the Westin. Tickets are $100, but if you are a corporate sponsor, I hope there are businesses out there that want to sponsor veterans. If you buy a table of 10, it's $900. So you get one ticket for free. So it's our first one ever, and we're excited. It's a lot of planning involved. I think we meet like every week or maybe twice a week.
And what's the idea behind the gala? It's kind of like a military ball, like all the services have. Is that kind of the idea?
Sort of. I mean, we're gonna have the colors. We're still looking for entertainment, but it's just for us to get together, and we don't have that. You know, when you become a veteran, you don't attend those anymore. You know, you're kind of like, oh, you miss it, right? Because it's something that you did every year. So hopefully, veterans will want to attend this one.
All right.
And then our next one is the very next day, November 11th at Chamorro Village, our second annual 5K, Veteran 5K on Veterans Day. And it's going to be a sunset run, so we're not competing with, all the other 5Ks. And that's going to be at Chamorro Village, showtime 4 p.m., go time 5 p.m.
All right. Anthony, you want to elaborate on that gala and its importance? What are you guys looking forward to happening?
So a lot of times in the past, we've confused Memorial Day with Veterans Day. So everyone feels that Veterans Day is supposed to be a somber event and we don't do anything. We don't celebrate our veterans, right? It's just, okay, we go to the government's Veterans Day event, 11 o'clock on the 11th. And we say, okay, these are the veterans of the year. After that, everyone's supposed to just go their separate ways and do absolutely nothing. So we had started something 2 years ago, which was just a Veterans Weekend. And it was during the time of COVID, so it was difficult for us to have something really huge. So we still did that, and a lot of the veterans enjoyed that. They had a little stage. Some folks came out. We had to practice all the social distancing and everything, and we still were able to get a good group of them to come out and enjoy that. And I think right now is a really good time to be a veteran. And what we're doing is we're encouraging all our veterans to come together. We're letting them know there's a lot of things that they can avail of. We want them to understand that, hey, we have to be a really good part of this community and of society, and they continue to give back. And by celebrating what we do on Veterans Day, celebrating the veterans, and no longer pushing them down or always talking about the negative things about it, we bring them together and help them to get their benefits, help them to feel good, and just all in all have a good time. And at the same time, we're raising funds to continue the things that we do. And a lot of the folks coming out to support are folks that have seen the benefits and the results of what we've done, and they want to continue to do that. And we want to bring all the veterans out there. So we'll start with this and the run, and then we continue to do what we do.
All right, sounds good. We only got a couple of minutes left, so I want to give you one more opportunity to explain how they can get a hold of you if they want to go to either of the events, and to be able to, avail of your services. I'll start with you, Karina.
Okay, so we, the Guam Running Club is advertising on their Facebook page. We're also going to be at the mall this weekend, 11 a.m. to 4 p.m. Center Court on the escalator side. I know some people were looking for us, but I guess you have to know which escalator we're at. So we're the one facing Macy's. So we'll be there this Saturday, this Sunday, October 28 and 29, 11 a.m. to 4 p.m. And then for the gala tickets, they can contact either me or Anthony, 682-7631 for me, and then 688-3607 for Anthony. There's also one other thing that I do want to talk about for events. So we have a monthly benefits boot camp. We're not going to have one for November, but we just finished our October one, and we had that at the Sinajana Mayor's office. So we haven't finalized the details for December, but we're on boot camp number 23 for December. And he started at boot camp number 1, and he used to say, it was just me like standing up there talking about everything, but now it's evolved, I want to say. So now we have PowerPoint presentations, we have different speakers coming up, we have testimonials from veterans and other veterans. After, I want to say maybe 2 or 3 days after they hear that someone went to a boot camp, then they're asking us, well, when's the next one? So I want to hopefully in 2024 just have a calendar of all of our boot camps and to know exactly where it's at, what day it is, so we can start registering people for that. Because, you know, family vacations get in the way, work gets in the way. But I just want to tell the veterans out there, this is your claim. You served, and if you have a disability, you should file for it.
Sure, absolutely. Okay, we're gonna let you wrap us up, Anthony. Just invite the veterans out there to come see you and avail of your services.
So yeah, we'll be at the mall this Saturday and Sunday. If you haven't gotten onto our chat groups and you're a veteran, get on there, right? Find a friend, talk to somebody, call us. You have our numbers now. Send us a text message and say, hey, I need to get on that chat group, number one. Number two, you got to come out and enjoy the gala. It's going to be November 10th. It's going to be at the Westin. And you don't have to dress up. This time around, we're kind of doing, what's the?
Island formal.
Island formal, which, you know, if you come in there looking, you know, not so spiffy, we're not going to mind, right? But it's there for a reason, for us to come in there to raise funds and enjoy each other's company. Then the following day, we're going to be doing the Sunset Run. There are a number of other events going on around that time frame. We're going to have the celebration for Veterans Day from the front office down at the museum. There's going to be a Wounded Warrior ride that's going to be going on. So a lot of things going on. So come on out, veterans, have fun. Let's stay together and keep doing these good things, because nobody's coming to save us. It's just us for now.
All right, that's Anthony Tyron. That's Karina Balesta. I'm Nestor Licanto. Thanks for watching, everyone. We'll see you again next week on The Hub.